Let me be clear. No, this is not substituting addictions. Let me explain. First, we should define terms. There are some common phrases thrown around: addiction, substance use disorder or opioid use disorder, opioid dependence, and substance abuse. Let me make 3 points. One, addiction is different from physiologic or physical dependence. Two, substance use disorder or opioid use disorder is just the formal, official sounding diagnostic term used to describe addiction. And three, substance abuse is an outdated, stigmatizing phrase that we try to avoid using. So back to point 1 and 2. Addiction is different from physiologic or physical dependence. Addiction, aka substance use disorder, is defined by continued use of substance despite negative consequences, loss of control, cravings, and inability to cut down. Addiction can also be defined by physical dependence, leading to tolerance and withdrawal. But we should be clear: physical dependence to a substance is not always addiction when it's under medical guidance. A person with high blood pressure may be physically dependent on their blood pressure medication, meaning if they suddenly stop taking their prescription, they could experience withdrawal symptoms like an increase in blood pressure, a pounding headache, even nausea or vomiting. Does that mean they're addicted to their blood pressure med? No. So someone can be physically dependent on buprenorphine or Suboxone. If someone suddenly stops taking their Suboxone, it's true, they'll experience withdrawal symptoms. But the person's not addicted to Suboxone because they're no longer having cravings. There are no more negative consequences. They've regained control of their lives, right? It hasn't been canceled yet. I wish it could be canceled. I mean, when you hear the word abuse, what do you think of? You think of violence and trauma for people. But a person with addiction, they're not an abuser. Substances are not abused, people are. Substances are used or they're not used. Maybe they're misused or used in unhealthy or risky ways, but no one abuses a substance. When we call people substance abusers, we're essentially judging them, blaming them, othering them, instead of recognizing the human being who's struggling with the neurobiological disease of addiction. The critical point here is that being on Suboxone, especially early in recovery, is truly life changing and life saving. A person is no longer in active opioid addiction with Suboxone treatment, right? I can't tell you how many people tell me that this medicine has saved their lives. No more cravings, no more negative consequences at work, at school, at home. So if you or a loved one are considering Suboxone to treat opioid addiction, but you're worried about getting trapped on subs, that's not true. Suboxone does not get you trapped. It's actually the opposite. It's liberating. It's freedom. You're getting free from having to chase your next dose, from constantly having to worry about avoiding withdrawal, maybe from the lies, the secrecy, and shame surrounding the opioid use. That being said, your opioid receptors in your brain are afflicted by the disease of opioid use disorder. Whether you're on Suboxone or other opioids, you are currently physically dependent on substances that activate your opioid receptors. Physical dependence to opioids, including buprenorphine, takes time to overcome. It requires gradual tapering of opioid receptor activation and learning to use tools that are not chemicals for managing your mental and emotional health. Would you rather be trying to taper off some pills that you're getting off the street from your plug or dealer? Or would you rather be trying to taper off with the compassionate support of healthcare professionals who just want to see you be healthy and whole and free? So If you or a loved one are considering Suboxone to treat opioid addiction, but you're worried about getting trapped on subs, let's get off opioids first. Then, once you're stable on Suboxone and the addiction is in remission, we can work with you on developing the best plan for you moving forward, whether that's maintaining on buprenorphine or tapering off buprenorphine in a safe manner.